Back here at 8:54 this morning, advancements in prenatal testing are giving expectant parents in-depth details about their unborn child. Doctors are finding it easier to diagnose Down syndrome, resulting in a dramatic decrease in the Down population. We're joined this morning to talk about what it all means with Dr. Brian Skotko. He is from Massachusetts General Hospital, leading specialist in the field, and Maureen Gallagher, the executive director of the Mass Down Syndrome Congress. We appreciate both of you coming in this morning. Brian, I want to start with you. What is the current population of people with Down syndrome in the United States, and what is the trend?
We know, Gene, the Centers for Disease Control and Prevention have counted, and there are about 250,000 Americans living with Down syndrome. But I think what's so breathtaking about that number for most of us is that number, Down syndrome, which used to be the most common chromosomal condition, is getting close to being reclassified as a rare disease, or what some people call an orphan disease.
Which is really remarkable if you go back at all. The prenatal tests are less invasive, highly accurate. What do you think the impact of these tests has been as a result of all the advancements that have been made?
When we look back at historical data, as new prenatal tests are introduced, more women can learn about the diagnosis prenatally. Therefore, more women can make the decision whether or not to continue the pregnancy. So an open question remains, now that we have a new non-invasive test, which has no risk to the pregnancy, that a lot of women are starting to get, are we going to see the population of people with Down syndrome decrease even further?
Now, it's an intensely personal decision, obviously, but Maureen, do you have any research which explains or tells you why these parents who are learning of this diagnosis are deciding to terminate their pregnancies?
Well, what we've heard over the years, Gene, is that many families, after they receive the diagnosis, receive either no information at all about Down syndrome or accurate, outdated information. So the MDSC is working really hard to ensure that when families get the diagnosis prenatally, that they right away know what life is like living with Down syndrome today in the 21st century.
There is a lot of research, and I know you know this personally and anecdotally, Brian, that when there is a diagnosis, parents are usually only given a very negative portrayal of someone raising a child who has Down syndrome. What's being done to sort of balance that out? Because that ultimately is what the goal is here, correct?
That's right. From research, we've learned that parents aren't always getting that up-to-date, accurate information. So how do we get that information to them? And my colleagues and I at Mass General Hospital enjoy partnering with the Massachusetts Down Syndrome Congress to really bring the information to expectant parents if they want it and when they want it.
What types of things are you sharing with them along those lines?
So we're fortunate at Mass General Hospital to have a new prenatal services consultation. So my colleague, Dr. Ali Schwartz, and I work with an incredible team of healthcare providers. And if expectant parents get that diagnosis and they want to talk to us in a private setting, in a confidential setting, we will talk to them about what it means to have a child with Down syndrome. We'll introduce them to someone with Down syndrome if they would like. And more importantly, we'll make the connection to the Massachusetts Down Syndrome Congress so they could get the information and meet other families.
And you've done a lot of hard work in that area too, Maureen, so much so the governor signed into law last June a new law which is going to help you very much balance out to make sure both sides of the story are being told here when that diagnosis is presented. What exactly does that law do?
Well, we're really excited about the new law. It's called an Act relative to Down syndrome genetic test results. And now with this new law, the Department of Public Health is required to ensure that all medical providers are giving accurate, up-to-date information along with helpful resources to new families. And right now, we're working with DPH to disseminate a new booklet called Understanding a Down Syndrome Diagnosis. And that book has information about Down syndrome, information of the choices and decisions that families have to make, and also information about resources. And the MDSC is not a pro-life or a pro-choice organization. We're a pro-information organization. We want to make sure when families are making these very difficult decisions, they have access to this information.
And your organization does tremendous work, and you're always there for people. So if folks want to reach you, Maureen, what's the best way they can find out more information and get in touch with you folks?
Well, our website is mdsc.org, and there is a tab for new parents and expectant parents, and they can go right to that tab, connect to our organization, and our family support director will connect with them within 24 hours to provide support, guidance, and information.
And you finding, Brian, that this has been working out well so far, that the balance has, it started to level off a little bit?
I think we're very lucky here in Massachusetts to have the resources, to have a community, to have a new law, to have doctors who care, and hopefully we'll be able to implement it over time.
Well, we appreciate both of you coming in and sharing this very important information with us this morning. Dr. Brian Skotko from Mass General Hospital, Maureen Gallagher from the Mass Down Syndrome Congress. Again, thanks both for your time this morning.
Thank you, Gene.
All right, Fox 25.